Hi, my name is Priscilla Kellert, and I was a courier at FNS in the spring of 1976. I currently live in New Haven, Connecticut, although I have a farm in Vermont and a house on Martha's Vineyard. I've also been involved in education for most of my career. I attended Yale University and also the Yale Forestry School. I heard about FNS when I was working at my first job out of college at the American Field Service in New York City. A young woman named Cindy had been a courier and she told me all about it. It sounded great, so I knew I wanted to sign up. So after a year, I left New York, first headed out west to Wyoming to the National Outdoor Leadership School where I did a Knowles semester. And then in the spring, I headed to Eastern Kentucky. I heard it was founded in 1925 by Mary Breckinridge, and the legend was that the nurses and the midwives would travel around by horseback, literally catching babies because it had one of the highest birth rates in the nation. Fortunately, FNS has taken care of that. The horses have been replaced by jeeps, and that's what we drove, which was also a lot of fun. So I left Sweetbriar, Virginia, where I was living at the time. My father was president. Drove through West Virginia, where there were a lot of those yellow squiggly lines because it's very mountainous, and then arrived. I was greeted by some lovely elderly ladies and also met the two other couriers, Mary White and Susan Whipple. We lived in the big house, and it was sort of a dorm. We had a common dining hall, so every night we would gather and share our stories of the day. I soon learned about the setup there. There was the main hospital, the Mary Breckinridge Hospital in Hyden, and then 9 outpost clinics where the nurses and the nurse practitioners would travel around, would have closer contact with the people in the mountains. So some of my memories, certainly traveling around with the nurses and visiting the patients in their homes. I mean, that was very memorable. Exploring the area with Mary and Susan, that was a blast. Getting a sense of the lay of the land, which was quite lovely. Certainly walking on a clear cut. I remember that was sort of almost like a moonscape. Seeing lots of coal trucks. We were in coal mining country. And probably the best thing was just visiting the country folk. On our free time, we would sit around and chat and hear their stories, learn their crafts. They made corn husk dolls, egg baskets, beautiful quilts, and chairs. And in fact, I bought 2 chairs from Cecil Morgan. I think he's a legend in that area. Listening to bluegrass music. The Morgan family also played a lot of banjos. So even though I didn't go into the health profession, certainly FNS had an impact on my life. First of all, just visiting and experiencing another part of the country whetted my appetite for world travel, which I've done ever since. And an appreciation for that culture, that Appalachian culture. As I said, the music, the crafts, the stories. And finally, a wonderful health system, mostly run by women, and those outpost clinics where nurses visited people in their homes was just a wonderful way to really directly serve the people. So thank you very much, and that's my story.